Welcome back to Psychology Works. Today we're going to answer the question, what's the difference between psychology and psychiatry? And a counselor or a therapist or a psychotherapist? This is a fairly easy question to answer. First of all, psychiatry is a subset of a medical degree. So people who are psychiatrists, they're an MD, and then they choose, do they want to go into cardiology? Do they want to go into podiatry? Psychiatry is one of these options. A psychologist, on the other hand, would have either a PhD or a PsyD. Traditionally, it was a PhD, Doctor of Philosophy, and then their chosen expertise would be psychology. Because when you get a PhD, you can get a PhD in anything, really. You can get a PhD in flute playing if you spend enough time studying it. The other degree that psychologists have is a PsyD, and that's a Doctor of Psychology. Now, the next question you should be asking yourself is, what do these two professions do? What is the daily work of a psychiatrist, and how does that differ from the daily job of a psychologist? Well, a psychiatrist, the MD, would be more likely to prescribe medication, although there are psychiatrists out there who do also engage in psychotherapy. In most states, psychologists do not prescribe medication. They will specialize either in therapy or research. So now that we've got that sorted out, what about the difference between a psychologist and a counselor or a therapist or a psychotherapist? The word psychologist is a protected term. It implies that the person does have a doctoral degree, either a PhD or a PsyD in psychology. And a counselor or a therapist is not protected. Anybody can call themselves a counselor or a therapist or a psychotherapist. The word therapist and psychotherapist I would use interchangeably. Sometimes psychotherapist is known to be more specific to psychotherapy, whereas the word therapy is more general. You could have physical therapy or speech therapy, or even pharmacological therapy would be taking medication. Usually when people say therapy and they're talking about psychotherapy, it's implied. If somebody has obtained all the credentials and licensing to be a psychologist, they'll usually promote themselves as that, but they may also refer to themselves as a psychotherapist or a therapist. If somebody refers to themselves as a counselor, they can also use the word psychotherapist or therapist, and they will typically have a master's degree. I hope that helps clarify some of these terms. Good luck to you, and this is Dr. Scott saying, remember, psychology works. Take care and take it easy.